Hello everybody, this is Dr. Ramy Fahim from Ankle and Foot Care Centers. I'm here to discuss with you a very important condition that we see a lot in our practice, and that will be heel pain. So the first question I get is, what is heel pain? Heel pain essentially involves, for the purpose of our discussion, inflammation of the ligaments and tendon structures in the bottom of the foot, specifically bottom of the heel, as it attaches to and fans to the bottom of the foot. A lot of misconceptions that we get about heel pain, and I want to tell you three common things, common points that your other doctors won't tell you. Number one, heel pain 90% of the time is treated conservatively. Number two, neglected heel pain can cause chronic pain. And finally, heel pain does not always equate to heel spurs. We always hear the term heel spurs or spurs in the bottom of the foot. That's not always the case. That does not necessarily cause the pain. Now let's talk about the how do we treat this condition? Well, the key component here is controlling the inflammation. When you have a lot of inflammation, that's when you get the pain in the morning, especially with your first few steps. And our goal here is to try to control this inflammation. How do we do so? Well, we could try cortisone injections. We could try anti-inflammatories, non-steroidal anti-inflammatories, pills. We could also try topical treatments. Now, once we control the inflammation, the real bulk of the treatment actually comes from physical therapy, stretching exercises, and controlling the foot mechanically to prevent any further stress on the tendon. How do we control the foot mechanically? Well, custom orthotics play an incredible role in this, and in doing so, we actually get rid of the stress and the strain from the tendon. Now, if none of the above works for patients, which we see this from time to time, options such as platelet-rich plasma injections come in hand, and they essentially involve taking platelet cells from your own body and injecting them back at the site of the inflammation, which is usually around the attachment of the tendon in the heel. Now, finally, another option that could be considered is shockwave therapy, and shockwave therapy works similar to platelet-rich plasma injections. Now, the final option would be surgical. Surgical in this case would involve releasing the tendon and its attachment, and again, this is something that we typically reserve for patients who do not respond well with conservative therapy.